Okay, so you're very welcome. My name is Professor Christine Loscher and I'm based in Dublin City University. And I'm here today with Mary Walshe, who is the Citywest Site Manager for the COVID-19 facility. And Mary is an alumni of DCU and has very kindly taken time out of her busy schedule to talk to us today about her experience. So Mary, you're very welcome. You're the first of our DCU alumni on the frontline voices, and we're delighted you could take time to talk to us today. So Mary, you've come out of retirement for this really mammoth task in this very important facility. So do you want to start by telling us a little bit about the reasons for doing that?
Well, I retired a year ago, so I spent most of the last year traveling. I've had a great year, and I headed off after Christmas for a big trip. So I was in Asia and Australia and New Zealand. So I was ahead of the virus the whole way, and I arrived back into Ireland on the 2nd of March. And I suppose I was glad at that stage to be home, because the first case was in Auckland just when I was leaving Christchurch. And I was doing what I would normally do, which is enjoying my time and walking and all of that. And I got a call from David Walsh's office, who is the National Director for Community Operations, asking me, could I come in that day to see him, and that he needed me to help with a project. So I went in that day, and he said to me, I need you to go out to Citywest. We're in negotiations to take over the site, and I need a self-isolation facility actually set up, and can you start tomorrow? So that literally is what happened. So I have to be honest, I didn't necessarily put up my hand straight away, but look, I was always going to help if I was asked. And you know what I mean, I headed out to Citywest not really knowing what I was facing into, because the last time I would have been in Citywest would have been at a social event. So it's a very different facility and complex, but a very large facility and complex. So I arrived out in Citywest on the 19th of March.
Wow. So you were literally ahead of the virus all the way around the world until you got home again. That's unbelievable. Yes. So tell us a little bit about what's been set up in Citywest and what's the function of this facility?
Yeah. So initially what I was asked to do was I was asked to take responsibility for setting up a self-isolation facility. But there is no reference point, because it hasn't been done before. And even if you try and look at the evidence of the research that's out there, had this been done in other places, I certainly couldn't find any descriptor in relation to it. So when I arrived out, who was sitting in the room had been sent out the same as myself, was a Director of Public Health, Dr. Deirdre Mulholland, an Infection Prevention and Control nurse specialist from Quality and Patient Safety, Aileen O'Brien. There was a member of staff from actually the National Forensic Hospital, and there was someone from the acute side. And literally the five of us were sitting in a room. And the first day, what we tried to do was start looking at a guidance, to develop a guidance document to what a self-isolation facility would be. Now, the negotiations were ongoing with the hotel. So although we were there, we weren't in essence in residence there at the time, because the negotiations were going on with the hotel owners. And those negotiations didn't finish until the 25th of March. So we opened a week later. We opened on the 1st of April. So there was a lot of work to be done, because in essence, you were setting up a clinical facility in a non-clinical setting, and you know, a very large area and so on, and try and plan processes and patient pathways that you had no blueprint. So you were really starting from scratch and designing it and planning it with no reference point to a certain extent. So we didn't know whether it was going to work until you actually have the first patient coming through the door. And look, there's lots of learning. You realize after 2 days that actually doesn't work, and you need to start again and change something in a different way. But the important thing was at the time is that the virus was very virulent. The number of cases being diagnosed were significant, and it was becoming very clear that, you know, with housing situation, and particularly with the fact that the outbreak was primarily focused in the Dublin area, that people were living in overcrowded facilities, people were living with people with a lot of comorbidities, and that therefore they were being told to self-isolate, and a lot of the time they weren't able to do that. And the concern was also that there was a pathway for people to leave hospital to stay somewhere for the recovery phase while they were still in the 14 days. So that was, I suppose, the premise initially of why the self-isolation facility was set up. So there was a lot of work to be done in preparing the facility, setting up clinical rooms, doing all the organising to have PPE and so on site, working out a referral forms, and how the process was going to work and where our referrals were going to come from. So a lot of hours and a lot of work to actually get us to the 1st of April for when we opened.
Yeah, a huge challenge. And so what kind of people are using the facility? So, you know, what in terms of its original function, is it, I presume that it's meeting that function. So who's in there? What's their circumstances? If you want to just
we followed very much the trends in relation to where actually I suppose the virus was hitting first and what has happened as the disease has progressed, you know what I mean, nationally. So initially when we opened, we took a lot of referrals from acute hospitals. So they came from all over Dublin and further afield, people who were probably in day 10 of their journey and needed another period of time to actually self-isolate. And I suppose the focus at that time was to ensure that we had as many vacant beds as possible in the acute hospitals. So it was a discharge pathway for people who actually had been admitted, had required actually, you know, significant maybe medical intervention, and then required a period of time where there was still some nursing and GP oversight. They weren't quite well enough to go home, and they also needed that period to get to 14, 15 days when they were post their illness. So in the first 2 to 3 weeks, it was primarily, most of our referrals came from actually hospitals. We then moved to a lot of healthcare staff were getting sick. So we started getting a lot of referrals from occupational health. And then from the nursing home staff as well, again, a lot of referrals. And then we moved to the outbreaks and the clusters that were in North Dublin. And then we moved to actually the direct provision centres. So we have been following the clusters and where actually the disease is progressing. So we have seen, as the testing has identified clusters and outbreaks in different areas, we have followed that and able to meet actually the requirements of the staff or the patients that required actually self-isolation.
Okay, so that's a really important function in that where there is an issue identified, you have been able to be a key facility in being able to manage that issue. I think that's really important.
To prevent community transmission, that's ultimately it. And unfortunately, you know what I mean, a lot of people are living in overcrowded settings, and you know what I mean, you have maybe 3 generations living in housing, or you have people that are in the middle of cancer treatment, and people certainly didn't want to be going from hospital back to that situation. So in that period of time, we've actually put through nearly 400 people have gone through since the 1st of April. Okay. So that's quite a lot of people, and some of them have been sick, and some have had needed to be transferred back to hospital, and everyone has they have the usual issues that would come to general practice as well. So we're very lucky to have the clinical governance from 2 very dynamic GPs.
Yeah. And in terms of the Citywest facility is quite large, so that it has quite a large capacity. And I think we've been lucky thus far in that we haven't had to max out that capacity. But do you want to talk for a minute about like what kind of scenario would it be where we would have to maximize a facility like yours?
I suppose there's the 2 settings. I suppose the self-isolation has the capacity for over 700 people, and I suppose the highest we've got to has been 169 people have required. Now that would include families, so we've had everything from a 3-day-old baby to someone in their 70s. So we've had that whole range of people that we've actually looked after. We had the capacity to actually go up to about, we would have said the maximum capacity on the facility would have been about 600. And I suppose it's a national facility. We took referrals from all over the country. And I suppose if we got to where we had about 300 to 400 people in it, certainly National Primary Care would have looked at opening other facilities around the country at that stage. But I suppose we remained as the national centre for self-isolation, so we took referrals from everywhere. The other project then is obviously the convention centre, which was really a project that was set up for a different purpose. And I suppose that's the photos that I would have sent you of, is the convention centre, which is a separate project.
Yes, and so let's just have, so I'm just going to, you kindly sent us a couple of lovely pictures of the facility. So I'm just going to pop them up on the screen here, Mary, and if you wouldn't mind just talking us through. So these are 2 lovely images that you have sent. Yeah. So if you wouldn't mind just talking us through. So do you want to just chat about this one here?
Yeah, I suppose the second project on site then, when I initially came in, it was for the self-isolation facility, which comes under the governance of community operations. And the second project then is under acute operations. And Anne O'Connor, the national the Chief Operating Officer asked me would I take more of a responsibility for the site. So at the time, Estates had in the HSE, when it signed the license for Citywest, took over all the buildings on site under license. So that meant that the plans at the time were to convert the convention centre initially into a 600-bed facility, which would be like a field hospital, camp beds and so on. And I suppose the thought process then, particularly looking at the modelling, is that to reduce the bed capacity, to have a better quality of facility to provide service. And I suppose at the time when this was planned, we were looking at the images from France and from Italy, where the acute hospital sector was completely overwhelmed. And also, I suppose, this was in the same planning phase as the Nightingale in the UK. And I suppose we've been fortunate in the sense that we actually haven't required to use it as yet. And currently, I suppose, the remodelling of the facility, it is now a 300-bed facility. So the beds you're looking at are what I would call the ordinary beds. So they have a bed space, they do have a call bell system, they do have electrical points, they do have chairs, they do have lockers and so on. There are shower facilities, there are toilet facilities, there are lots of wash hand based stations and so on. And then there's another area which I didn't send you, which was high observation, which is 50 beds, and those have piped oxygen to it. So I suppose this centre was planned and is planned currently for it to be a COVID-19 positive facility, where the transfers will come from the acute hospitals for people who need rehabilitation focus after having been a period of time quite ill in hospital. And we're working up a plan in relation to the staffing for 30 to 60 beds, and we're currently, I suppose, just working through that. I would imagine decisions would be made about this facility in the next few weeks in relation to its opening and its function, and whether it is a COVID positive or a COVID negative facility, because it's either one or the other. And I suppose also it was there if the acute hospitals were going to be overwhelmed. We absolutely accept that's not the ideal. It is a clinical setting in a non-clinical facility. And yes, there are pluses and minuses in relation to that. But I suppose we will be facing into a very difficult period of time coming into the winter again. And this facility will be there to support actually the acute hospital sector, but depending on what the criteria is in relation to the patients that are required to be admitted. So I suppose there's still a lot of thinking about what that facility will be used for.
But it sounds like it's a really important facility to have in place.
Yes.
In such case as we get another surge in virus transmission and the numbers go up, and it starts to put a huge amount of pressure on our current acute hospital system. So, I mean, what does our hospital system look like if your facility is full?
I suppose you know what I mean, at the minute the acute hospitals are ramping up in relation to actually the normal activity as well. As the COVID admissions decrease, the normal activity is certainly increasing in both the private sector and the public sector. So, you know what I mean, if we look at what a normal winter looks like without COVID, we still have outbreaks of flu, we still have outbreaks of other infectious diseases. You know, the planning around what is going to be appropriate now is going to be different than actually what may have been acceptable actually last year and the year before. Are trolleys going to be acceptable on corridors? You know, these are the questions that have to be asked. Is bed capacity in 6-bedded wards going to have to be reduced? I suppose I'm just talking what has been, I think, part of the discussions that are ongoing. And those determinations will have to be made, because certainly in the older wings of hospitals where 6-bedded wards, the spacing would not be appropriate. So hospitals and hospital management teams will be reviewing the context of what the new normal is. And does that mean that absolutely there's no tolerance for trolleys in places that they would normally be? Does it mean that the actually bed capacity has to be reduced to actually meet actually the public health advice? And therefore, the whole role of having additional 300 beds available and what that can be utilised to support actually the acute hospital sector, it has to be considered in the context of what we might be facing. And I suppose the concerns from public health are that when the restrictions are lifted, that we will see a spike in presentations of people who are diagnosed positive from COVID-19. So all of those considerations, and I think people are planning in a vacuum, and that's the difficulty at the minute. But the facility will be ready, and I suppose we're trying to ensure that we have a minimal staffing for 30 to 60 beds in the first instances, and then it can be incrementally increased. But 300 beds is the size of some of our hospitals.
Yeah, and it sounds like the facility that's in place can evolve to meet the need. If the need changes, that this facility can evolve to be able to meet that need. I suppose
the clinical criteria is going to be really important, because we know it's not the ideal. It's not ideal for, you know, quite frail people. It's not ideal for people who are acutely unwell. You know what I mean? The descriptor will have to be medical patients or people who are in the recovery phase of any illness. And I suppose it's a facility that could be utilised. We absolutely accept it's not the ideal. But is it better than a trolley on a corridor? And they're the questions that need to be asked.
Yeah, no, absolutely. So just in wrapping up, Mary, you know, what do you say to people at home? You know, you're frontline staff. There's lots of frontline staff in the country. You know, you're playing your part. You know, what do you say to everybody at home? Like, what's our part?
I think there's a lot of people that know no one that has had COVID-19. And I think anyone that has actually seen this illness visibly with either patients or a family member knows the impact that has on the individual. And I suppose I might just reference prime time last night, because actually I would know Mimi, who spoke about the illness, the consultant geriatrician, a brilliant clinician, absolutely committed to patients, who became very ill herself. And, you know, I know a number of people who have actually been quite ill, and no one really no one should be jeopardizing public health advice in order to actually do something that could jeopardize their own health, because this is not an illness that anyone wants to get. So again, it's really important to adhere to actually the guidelines that are out there, the washing of hands, the cough etiquette, keeping distance, you know, all of those sort of positive things that we've been doing to continue with that, because we have seen people deteriorate quite rapidly, even here, who we have had to transfer back to hospital, who have become very unwell, even at the end stages of their illness. So from that perspective, it is presenting in an unusual way. The symptoms are unpredictable. Anyone that's had it are still feeling the effects a number of weeks later. And it is really important that we minimise community transmission in the best interest of all of us concerned, because it's not something that anyone wants to bring to their family or get themselves. And I think none of us know what actually the winter will be like if there are other illnesses that will come, flu and other you know, transmissible diseases come on top of that. So I think we just need to keep safe.
Yeah. So Mary, thank you so much for talking us through, I suppose, the real importance of the facility that you're managing at the moment. I think it really points to the important role that you have and the significance and impact that what you're doing actually has on COVID-19 in Ireland. So just thanking you on behalf of DCU and all of its alumni. You know, you're a real example of what our alumni are doing out there at the moment in this COVID-19 crisis. So thanks so much for taking this time out of your busy day and talking us through the work that you're doing and the importance of the work that you're doing.
Yeah. Thank you very much. It's been a pleasure to talk to everyone. DCU was was the first year that actually the postgraduate degree in nursing was undertaken. So a lot of us have gone on to senior posts in health service. So, you know what I mean, DCU certainly supported me in my career over that time. So look, thank you very much, Christine.
Thank you very much.